Brings us to our next story. It has been a heavy week as we continue looking for answers after students took their own life at Parma Heights Valley Forge High School. And now the community is wondering if this could have been prevented with expert care. So we're going to send it over to Danita in Studio B. This is a very heavy topic.
Very heavy topic, but an important one. And Dr. Molly McVoy is a child and adolescent psychiatrist with University Hospitals, and she actually trains teachers how to detect mental health issues in students, and she joins us this morning. And I just want to thank you for being here, and also thank you for doing the work that you're doing.
Absolutely.
Tell me a little bit about how you're training teachers to identify these things.
Sure. So it's a hard time to be both a teenager and a teacher. And there's a lot. We need more, of course, for students. But my experience working with teachers, there's very little to support them. And luckily, from a lovely donor and then from state of Ohio, they agree that we needed to learn more. And so I started with understanding what the teachers wanted. So we did some focus groups to get their input, what the parents and the students wanted. And then we've developed workshops to help support signs and symptoms of mental illness. What do you do in your classroom? How do you help support these kids? And they're hungry for it. And it's really, as heavy as of a topic it is, it's really a joy to see that I'm able to be a resource to meet that need.
What are teachers saying to you? Are they relieved that someone is finally paying? Okay, give me a little of that.
And that someone is there that destigmatizes it, that they know that so many of their students are challenged with all the way from worries about a state test, or they're homeless and they don't have enough food. They know this is happening and that there is something they can do, and there are strategies to help make their classrooms better.
Why is it important that students have the knowledge that there's help at the school and they have access to it?
They need to speak up.
Okay.
So I also work with Life Act that works in schools that does suicide prevention. And if a kid can identify one trusted adult and know that this adult will be there to help them or help their friend, that's almost always what it is, you can prevent things. A kid knows what to speak up about and knows who to speak up to. There are adults that are there that want to help them.
What are some things that a teacher should look at? Give me some signs. What would you say?
So what are kids supposed to be doing? They're supposed to be at school, having fun, hanging out with their friends, and getting their stuff done. If that changes, if you have a kid who's withdrawing, who used to come but doesn't come, who used to participate but doesn't, who used to be a happy kid but all of a sudden is a irritable or angry kid, a change from that kid that you knew at the beginning of the school year is what is the first thing we look for.
And how has your research grown or changed? What have you seen change as long as you've been doing it?
So what we've seen, one of the things is a good thing. So since the state of Ohio has put in place the rules around social media and the rules around phones, I think teachers think that is helpful. They've seen that having a policy around not having phones in the classroom has helped.
Okay.
I certainly spend way more time this last 5 years than I ever did in my early career understanding and talking about technology and social media in
Because
schools.
it has made an impact on their mental health.
Absolutely.
Wow.
It's there all the time. When we were little, I won't say when I was in school, we went home and that was it. It didn't follow you. So now it follows kids 24 hours a day. So helping the kids and the teachers understand what to do with that has become an increasing part of this program.
Give me a little insight in what now Valley Forge High School and what happened, and now it's after it's happened.
Yes.
What are the kids experiencing?
So to a varying degree, so some of them are experiencing full-on post-trauma kinds of things where they're afraid and, if they knew her or if they knew anything, and I don't know any of the specifics of the situation. And then some are just experiencing disruption in their schedule. And so there's going to be a whole range of things from kids who are really affected by this all the way to kids who just want to get back to their day-to-day lives and get back to their routines. And
some sense of normalcy.
Yes.
Yeah, they need a sense of normalcy.
And same thing for the teachers.
Yeah. Yeah, because the teachers, and that's why I'm glad you did a study on the teachers, because sometimes they're forgotten.
They are totally forgotten.
But they need the help as well.
They need the help, and they need sustained help. We talked this a little bit before we started. It's so important, and things like this that happen highlight it. And I've been so grateful that there's places in the state that recognize this, but we have to keep at it.
Yeah.
It's a marathon.
It can't be just when the tragedy happens.
Correct.
We have to keep it going.
We have to keep supporting our teachers.
Wow. Dr. Molly McVoy, great job that you're doing. Thank you for being here with us this morning and bringing us some insight. And Dave, as you heard her, this is something that we just can't hit it and quit it.
Yep.
We have to keep the support going for the teachers as well as the students.
Yeah, both. And it really hit home when she talked about it follows the kids home.
Yeah, that phone.
And she brings up the teachers. One of the most important interviews we've had here
Yeah.
on the stream, Danita, no question. Fantastic job helping people out. All right, thank you.